Cosmetics is, it's a big business and it's just evolving and evolving. And this time that we spent at home, during COVID, people have gone two ways, amplifying what they think, or they're like going, right, I had all this time where I couldn't spend my money on because I couldn't go out, and they're like, this is what's important.
That's Shiree Walker, a nurse practitioner who's joining me on my warm table for a 3-part special where we'll be talking about everything from pelvic floors and menopause to cosmetic wrinkle relaxants and adrenal fatigue. Shiree popped over after leading a community yoga class where all the proceeds went to her favourite charity. Over chicken sandwiches and cups of tea with lots of sugar, we talked for hours recording these bites of wisdom, especially for women, busy women, tired women, menopausal women, ageing women. Do any of those sound like you? Well, I can tell you they certainly sound like me. Shiree has amazing knowledge, experience and qualifications to support a growing need and demand to tackle these issues head on. I learnt a lot and I laughed a lot with Shiree that afternoon, and I hope that you will too. Shiree, thanks so much for joining me today. It's just such a pleasure to meet you, and I'm so excited about hearing the work that you do because I have to admit I hadn't heard of a nurse practitioner as a job title, as a role, until really recently. So could you please tell me a bit about what a nurse practitioner is and maybe even your road to get there?
Yeah, for sure. And thank you for having me. So a nurse practitioner, so we all start off as registered nurses. So we've done an undergraduate program through a university. And then we have gone on to get more experience in a clinical area. So we are senior registered nurses. Then we move on to doing a master's degree. So just depending on which university you go to, depending on what it's called. So I did a Master's of Nursing Nurse Practitioner degree. And then from there, the next step from there is then being endorsed by APRA, which is the governing body for health professionals, to then have endorsement as a nurse practitioner to be able to then work in whatever field, public or private field as a nurse practitioner.
And then what do you do as a nurse practitioner?
So depending on what field you're in, but the general goal or role of a nurse practitioner is we are able to do, or should be able to do, head-to-toe assessments. We can order and interpret pathology and radiology. We can prescribe medications. And we can diagnose clients.
There's quite a few GP clinics now, I think, who also have nurse practitioners working there alongside the GPs, so in very similar roles. Is that fair to say?
Yes, yep. So they either will do a similar primary healthcare or they might have an area of specialty while they're working in a GP practice. So it might be women's health, children's health. There are some nurses who are dual midwives and nurses, so then they go into the nurse practitioners, so they can do maternal health and children's health. Lots of different areas. And I do know of a colleague who, diabetes nurse practitioner, so that also really lends to working within a GP practice. Also mental health nurse practitioners. So there can be a wide variety, but I guess treating clients who have more that chronic disease element, so that really works well in the primary healthcare setting.
Yeah, brilliant. I want to touch a bit more on your experience, but I want to jump straight into some of the really interesting things that you're doing, Shiree, because we've just actually enjoyed lunch around my warm table, and of course we've had the most amazing conversation. Which I said, no, stop. We need to record this now because what you're doing is just so interesting, and I want you to share the work that you're doing in cosmetics because it's a growing industry, but it's also something that is, we've really got to do it with caution.
Yes, definitely. So I was working in the emergency department. At the same time, one of the doctors that I worked with, her plan was to go further her training as a GP and get into cosmetics as well. So I put my hand up out of interest and said, if you're ever doing this, let me know.
I'm keen.
Yeah, she rotated, went to another hospital. We stayed in contact, and then when she was ready, she was like, Shiree, I'm going to be doing this. So we trained up together. I did extra studies in that area, and then...
So you're already a nurse practitioner at this point?
Yes, so when I met her, I was doing my nurse practitioner studies, and then by the time she was ready to do that, was a nurse practitioner. So we did our training. She then moved down south to finish her GP training and didn't come back up to Perth.
Uh-huh.
But we stayed very much, and we are very much in contact. She's my collaborative doctor that I work even though we're separate, we bounce ideas off each other. So I then still work in the emergency department, had done my further studies in cosmetics and started just slowly doing a couple of clinics around Perth, and then got involved in a local clinic to myself and had an amazing nurse there who was a very experienced cosmetic nurse take me on board, train me up a bit more, got into more the skin side of things, and then that's kind of evolved. So I still stayed in ED for about 8 years after that. Cosmetics was kind of like my side gig.
Yeah, sure.
Yeah. And then I got a bit more into it. I always had my foot in there, and I could see that it was beginning to grow, and a lot of nurses and doctors were trying to get into the field. And I did have this point where I was like, oh, maybe I should just like step away from it. And I actually had people go, Shiree, like, do not, because it actually for nurses is quite hard to get into the field.
I think something that I've certainly found in my experience of anything medical is that nurses take the time to explain things in really great detail and in normal words, which is always helpful when you don't have a medical background. Yeah. And I wonder whether that plays a part in you as a medical practitioner.
I think so. I'm a very visual learner. Like, I like pictures and diagrams till the cows come home and we'll use it a lot in my consults and explaining. And I think because then clients get it and then they know exactly what they're in for and why you're choosing one treatment over the other, or if you give them several treatment options and they can go away and think about it. So I think that probably came about from my previous background doing like wound care and continence, because it's a very internal visual thing. My one example is when you explain to someone pelvic floor, people are like, what? How do I engage it? Where is it?
How do I find it?
Yeah. So, we really had to get the diagrams and that sensation of getting people, right, well, it's connected here, here and here, do this. So I think it's evolved from that I realised that people needed that visual and an understanding, and to break it down in a language that they can, definitely understand.
So, Shiree, I just want to find out about what it is that is cosmetics for someone like yourself as a nurse practitioner. What do you do in that field?
So I do a variety of things, mainly injectables. So that includes wrinkle relaxers, dermal fillers. Then I do a treatment called PRP, which is platelet-rich plasma.
Oh, I want to know about that. That sounds interesting.
So that is a procedure where we take the client's blood sample, we put it in a specific tube, we spin it in a centrifuge. Then their plasma rises to the top of that tube, which has all these great growth factors. We're able to draw that plasma out and then able to re-inject it back into their skin.
Oh, okay. And why would people want to do that?
So one option is they're potentially not ready for dermal fillers. So PRP is a more quote-unquote natural way because they're using their own body products.
Oh, okay.
But it does help with collagen stimulation and elastin stimulation. So you can inject it into fine lines. It helps to tighten the skin. It can be used in areas that are tricky to treat, like under-eye tear trough areas. Fillers in that area can be quite problematic for some clients, so PRP is a good alternative. You can also use it for hair growth and stimulation as long as there are hair follicles present.
So you have men and women going back in for that?
Men and women, yeah. I have a few men and women who are having that treatment. So it can be used as quite a wide variety of areas. There are some other treatments available, which I will tell you about. You do have to be specifically trained by a doctor. He owns the trademarks on these specific procedures, so you can't use these names without having done his trading, and then I think you potentially pay him a fee for that trademark.
All right.
So one is called the vampire facial.
And where did that come from? Because I know there's a story behind that.
It got quite well known. If you Google Kim Kardashian and vampire facial, you will see a picture of her looking very happy, covered with blood.
Oh my gosh.
On her face. She went and had this treatment, and it got a lot of traction after, of course, that picture.
As it would.
Yeah, it went viral. So it sparked a lot of interest. So that was using platelet-rich plasma and then skin needling it into the skin and getting a lot of blood. Under this doctor, you can also train for...
Sorry, I'm so new to this. The thought of any sort of fillers on my face or anything just hasn't got there yet, because I'm sort of the other side where I'm just sort of thinking, I don't want to put anything in my body because I'm actually trying to get rid of a lot of stuff.
Yeah.
At the other end of it, right? So all of this is just so fascinating for me. So I don't understand why you'd be needling your skin and making it bleed.
Yeah.
And yeah. So can you just walk me through all of that?
Yeah.
Oh, awesome.
So skin cell turnover in the body is 30 days. And also, if I explain to clients, if you were to injure yourself, so you got a cut, but there's this whole process your body goes through to stop the wound from bleeding, remodel the skin, heal it, get your pigmentation back to normal. That can be a 30-day cycle. So with doing things like skin needling is a controlled injury of the skin. So we're using a special machine like, so this is another treatment, something called skin needling device, or people might know it as collagen induction therapy.
Right.
So it's a specific machine that's used that kind of, it vibrates, it has a sterile head on it, and you dial that head up to a certain amount. So it goes from 0.5 to 2.5, depending on how much penetration you want, and also your endpoint. So there used to be this thing where having that blood was like, oh, that's a good endpoint, but now there's more research saying you don't actually need that gory blood look. You can just get this nice redness in the skin, and what that controlled penetration of the skin is doing is increasing that skin cell turnover. So it's treating things like a pigmentation, so it's kind of making the pigmentation in the slightly deeper layers of the skin break up, rise to the surface, and then slough off, essentially.
Right.
It helps with like acne scarring, surgical scarring, because it's recreating that collagen stimulation, which, with acne scarring can be very different types of scarring, like really deep scarring, pitted scars, tethered scars. So it helps in that process as well. And then it helps with fine lines and wrinkles. So it's a bit of a all-rounder. And same again, it's just using your own body's natural, doing this skin remodeling. So it is, and you can do like, normally you can do your face, your neck and your décolletage. You can do the backs of hands. You can actually do really anywhere on the body. You can do like sometimes on tummies, like for stretch marks as well. So it's one of those ones where skin needling can be used for a wide range of areas as well.
What's the thing you get asked for the most?
I think, call it the gateway drug.
Gateway drug. I love it. Tell me, what is it?
I would say wrinkle relaxers.
Wrinkle relaxers.
Yeah. So we have 3 drugs available in Australia as wrinkle relaxers. So one's called BOTOX, one's called Dysport, one's called Xeomin. So they're the Therapeutic Goods Administration, TGA approved drugs in Australia at the moment, but we call them wrinkle relaxers from an advertising point of view on our social media. APRA guidelines, we can't mention the name, so I'll just podcast like I mentioned them.
Yes.
We'll call them wrinkle relaxers from here on in.
Now, I've got a lovely friend of mine who talks about preventative BOTOX. She talks about preventative BOTOX, and I've always found that really fascinating, that whole term about preventative. So I'd love you to explore that with me as well.
Yeah. So wrinkle relaxers effectively temporarily stop the muscles from moving. They stop that muscle pump. So it's something that it's not permanent. If you don't like the way it looks or feels, it wears off. Your muscles go back to normal. So there is that thought process of, if I don't have a lot of wrinkles right now, if I just do a bit of a baby sprinkle, is that going to then stop the aging process? And it's also about the amount of product that's used. So we have, in each area we inject in the face for wrinkle relaxers, there's a certain amount that is safe to do. So we have a minimum and maximum dose which is safe to do in one sitting. Then we would review you. Normally the wrinkle relaxers take about 5 to 10 days to kick in, and then I'd normally review clients at about the 2-week mark, and then we can add on safely from there. If you go too heavy-handed is when you can get potential complications like droopy eyelids and things like that, which then people are then stuck with for until the wrinkle relaxer starts wearing off. So it's a lot easier to just start at a lower dose.
Of course.
And that's when the clients are beginning to hear about their friends having, baby BOTOX or, the sprinkle, I call it, and then kind of seeing how they go from there. And so, sometimes they want to meet you first, have a chat, see what you have to say before they think about it. Or they'll be like, they get to know you and be like, let's
just go.
Let's
just do what you need to do.
We'll do it. I trust you. You sound like you know what you're talking about. So off you go. So it's a bit of that, having a bit of wrinkle relaxer to stop the aging process, in that you're stopping fine lines and wrinkles from progressing. But
do you have to keep doing that though? So say you start the baby BOTOX or the sprinkle, in your 30s, to be in my 30s again, that are you actually stopping it, or are you just sort of pausing it for that moment and then it just accelerates again?
I think it's two things. One might be that you are going to have to potentially pause it if you have children. So we don't do any type of injectables during pregnancy and breastfeeding. So you will have that gap where you aren't able to have it done. And then also, if you're having, so that the lifespan of wrinkle relaxers is usually about 3 to 4 months, and that's when you would come back for another treatment. But depending on, I guess, how your muscles are moving and your muscle mass, you might need it. You might have a longer wear time than someone else. We just say the average is 3 to 4 months. So if you're starting when you don't have a lot of wrinkles, you might not need as much product, which means because your wrinkles aren't progressing, so you're not actually having it as often. So you kind of are stopping the aging process to a degree, but then you've got your other factors of health and lifestyle, sun damage.
Of course.
So it's not a necessarily given that just doing this is going to stop the aging process. So there are other factors that we need to look at as well.
Now, you've just raised a really interesting point, because I want to talk about sun damage, and I'm sure you see the results of sun damage. And look, that's something that I have constant conversations with in this house about, please put on a hat, please put on a shirt, please use some sunscreen. I would love you to help us understand, what does sun damage do and what does it look like, and where you might be able to help down the track. But preventative is always a good start.
Yeah. So we always say, when people ask us what is the number one anti-aging skincare product, SPF.
Yes.
That is by far, no matter what skin type, skin tone, ethnicity you are, SPF. Daily SPF is what is required.
And at what stage or what age should you start using SPF?
I would think early 20s, even as teens really, but whether you've got to get compliance with that. But yeah, early 20s and then moving on from there. And then I guess what I see is the pigmentation changes, specific sun where sunspots or sun has hit. Pigmentation potentially also can be hormonal changes, especially in women through, pregnancies, menopause, periods, and then the fine lines and wrinkles. So there's a couple of good articles that are out there, and there's some famous pictures that go around where they've got a picture of he's an American truck driver, quite an elderly man, and you see the side of his face that was exposed to the sun on the driver's side compared to the other side, completely sun damage, wrinkles, sagging. Or there's another one of twins, one who has smoked and had sun damage and then one who hasn't, and the aging process between the two identical twins.
Significant. Yeah. I
can see anyone at the beginning of their journey or at a preventative level in their journey. So I have a lot of mothers and daughters that actually come in, or the daughters who are like, Mum did this, and this, and I don't want to look like that, or I can see I'm beginning to look like that. So the skin pigmentation probably is the big issue that people find is aging for them. So sometimes it can just be like freckles, I quite like freckles.
I like freckles.
Yeah. But, for whatever reason, so with myself being of an Indian background, I know with my mum and sister, we get these darker spots, which is our equivalent of a freckle, but not as easy to reverse in a darker skin tone versus someone in a lighter, like a fair hair, red head, paler skin, like more Celtic background, where they've got freckles. You could do IPL treatments on them to potentially remove that pigmentation. So it really just depends on where they are. And then I guess the pigmentation, we're looking at what products we would be using to help get rid of the pigmentation, whether it's just skincare products or then going into those more not invasive procedures, but the next step, like the skin needling, which we discussed earlier. So there's lots of different potential avenues, then going all the way up to IPL, laser on the spectrum. I don't use laser in my clinic, not yet, because I feel there's plenty of other places who are experts in that. So I'm always happy to refer on if that's what someone needs.
SPF, number one, preventative aging.
Yeah.
So that's the easy thing we can all do. But then there are some tricks up your sleeve should we get to a point where we've got some sunspots and some sun damage. There is work that can be done to help the skin at that level.
Yes, definitely. So you can look at just specific skincare products. So these are more the products you would probably need to go to a clinic to get. They're not necessarily things you would buy over the counter, because you probably want a good skin assessment before you would go into these products, because they might not necessarily be the best thing for you depending on your skin type and what's happening. So there are products who will, I guess, kind of lighten and brighten the skin. There are some products which will actually suppress pigmentation, and then we go all the way to certain products which will increase skin cell turnover, which then kind of helps to lift the pigment from the deeper layers of the skin, bring it up, and then you kind of get rid of it. But that all takes time.
Yes.
Yeah. And then we go all the way into prescriptive medication for not lightening and brightening skin, but it's helping to lift that pigmentation. And there's different formulations. So there's the ones that you can get, a lot of GPs can prescribe, and then you go into compounded formulations, which would still the prescription, but getting it made up at a compounding pharmacy that can put different types of medications together that will help that process.
So that's an interesting part of, what we were saying earlier about a nurse practitioner, is that you can actually prescribe medications.
Things are also very much ever evolving. I was speaking with a nurse practitioner yesterday, and there are things like anti-aging, like actually compounding hormones into skincare medication.
Right.
As an anti-aging, so putting estrogen and progesterone into creams, CBD oil into creams. There's a lot of more research we need to go down the pathway, but there's these different formulations and combinations which work for some people, not necessarily for everyone, but there's different things that we can try. And this is where it is, if people aren't wanting to go down injectables, we've got that whole, what are we doing with the paint job on the face to help that anti-aging process? And if that's as far as I want to get, that's completely fine as well.
And that opportunity to compound just means that you can be a lot more flexible with what it is that it's not an off-the-shelf fix. Yeah.
So it's very prescriptive for that person. What works for one person might not work for the other, but it might work you and your girlfriend or your friend. It might work for both of you. So it just depends, and that's why we might start someone just on the skincare products first, just to see how they're going to make sure they don't have sensitive skin, see what works for them. Because I guess you don't also want to go to prescription if you don't have to. But if we need to take that next step, we've got the option there.
Yeah, great. So we talked about the gateway drug, which is wrinkle relaxants.
Yep.
Love that theory. And then what might be something people are looking to achieve with their look?
Then I guess the next step people then begin to play around with the idea or might ask questions is dermal filler. So dermal filler is made of something called hyaluronic acid, which is a naturally occurring substance within the body. They've just been able to recreate that in a lab so we can then re-inject it into the body. So it helps with essentially volumization of the skin. Depending on who you speak with, the basic they call it like it's a jelly. It is when you inject it out. It's like a clear jelly that comes out. So one syringe is essentially 1 ml, which is actually not a lot of product. People kind of go, I don't want to look like this alien when with 1 ml. 1 ml is the equivalent of 1 blueberry.
Oh, okay.
So it's actually not a lot of product. Potentially might be a decent amount of product in the lip because the lip is a smaller area, a smaller compartment. But if we're putting it in cheeks, jawlines, all these other areas, it's actually, you normally need like several mils to get a result. But also it depends on what a client wants and their budget as well. So you would probably just start off with a small amount, whatever's within their budget, and go from there. And so fillers, depending on which brand they are, they're all hyaluronic. Well, the brand that I use, it's all hyaluronic acid. Their structure is slightly different. So the best way I describe it is, if in the lips you would want something nice, soft and natural, but in the cheeks or the jawline, you probably want something with a bit more structure and a bit more lift. So that's how I kind of describe it. So we're not going to necessarily, because people go, oh, if I don't want it all on my lips, can you like put it here and here?
and use that syringe all over the place.
Yeah. So I kind of go, we can, but you're not going to get the result that you want because it's just not going to have the correct structure for that area we want to inject it into.
Do you think the lip is a bit of a trend at the moment?
I think it has been for a while, thanks to Kylie Jenner and the Kardashians.
They are so influential, aren't they?
But it's also flipped this trend of people saying that's not what I want to look like.
Yeah, right.
So it's this two-part effect. You do have certain demographic who want that look, and then others who are like, I don't want that look. I think it's probably the most popular in regards to filler. I feel depending on the age range.
Yes.
But it can have a really pleasing effect, but also not just the lips, but the whole perioral area can age someone. So it's not necessarily about putting the filler just on the lips. If you do the structural work around the mouth, can actually decrease the aging, the look of the age of a client as well.
Yeah, this is going to be a really silly question, but I'm going to ask it anyway, Shiree. With the advent of masks, are people wanting less filler on their lips because you can't see them anyway?
I actually think it's wanting more because they can have the downtime without people knowing.
Ah, I never thought about that. Okay.
So I've got
sunglasses, masks. Look,
Yep.
I've had my whole face done,
Yep.
but no one knows.
No one knows. Yeah. Or I'm working from home on Zoom and people can't really see what's going on. So it's that mix of
Who knew that? There you go. Everyone's secret. What's going on under the mask?
and the increase in like Zoom calls is actually, I think that's also maybe in par where cosmetics is taking off because people are like, is that what I look like?
It's so invasive, isn't it? Yeah. Every little flaw is magnified.
Yep. So it is that cosmetics is, it's a big business and it's just evolving. And this time that we spent at home, during COVID, people have, they've gone two ways where they're either not wanting, or I shouldn't say not wanting, or it's amplifying what they think, or they're like going, right, I had all this time where I couldn't spend my money on, because I couldn't go out, and they're like, this is what's important. So when we talk about wrinkle relaxers, people, when we assess their face, they have two different types of lines. So the lines are, they have their dynamic lines that come with expression, and then they can have static lines that come when they're not moving.
Resting bitch face.
Yes, yeah. Or I call like that, or they say my dad has that exact thing and I've got it. So
is it the 11s? Is
yes,
that what it's called? The 11s. I've heard it called the 11s.
Or forehead or crow's feet or just different areas
laugh lines. That's
yes.
what I'm calling them. I'm going for the positives here.
So wrinkle relaxers can, depending on how etched those lines are, like I tell people, if that's come on over like 10, 15 years, we're not necessarily going to be able to get rid of that, maybe potentially altogether. We might need to do other things. That's where the PRP might come in, and potentially the fillers. Now, fillers in certain areas of the face can be quite high risk. So into the 11s and the nose is quite high risk for complications, as in vascular occlusions and potential blindness. So because
that's very serious.
Yes, that's very serious. So even though cosmetics is like people think it's fun, there is this side of it actually is quite serious when things go bad.
Which is why you need to have somebody qualified, experienced, and an absolute medical practitioner who's doing that treatment for you.
Yeah, exactly. And so, and I don't treat that area. I'm more than happy I will actually refer it to plastic surgeons that I know. I have no problems in that. To whatever people are comfortable with doing, I'm not comfortable with doing that, and I'm minimising risk. So that might be where I might look at doing the PRP in those lines there, because that will also help with fine lines and wrinkles. There's a few different things on the market, and I'm not sure if you've seen, there are things called mechanical thread lifts, mono threads, and then collagen stimulator. So your mechanical threads and your mono threads essentially are very similar to the suture material that we use in hospitals. Yeah. The ones that are left inside. And then the mechanical lifting threads are long threads that are put in at certain vector points in the face. They're not equivalent to a facelift, but they might give you a little bit of time before, if that's the way that you're going to want to go down. So they will slightly elevate certain parts of the face. The threads are left in, and then over like the 3-month period, the threads will begin to break down in the body, and while they're breaking down, they're stimulating collagen and then holding the skin back. Then there are mono threads, which are also of a similar material. They're very small, thin needles that go in, that very small filaments of the similar type of material. So you can do a lot more structural scaffolding work throughout face, neck, décolletage, tummy, lots of different parts of the body as well. Same again, lots of little needles go in, leave these little threads of the material behind, and then same, they will break down, and also over about that 3 to 6 month period, then the collagen production increases, so they get that skin tightening. It has a bit of a skin brightening effect because your collagen is stimulating. And then you have collagen biostimulators, which is in a liquid form. So a collagen biostimulator, it comes in a powder form. We dilute it, we put a little bit of local anesthetic in it, and then we actually inject it into essentially the face. You can do it in other parts of the body. You might have heard like something of the Brazilian butt lift where they put collagen biostimulator in there.
Yes.
So we can use it in like the face and the jawline, the neck and décolletage. The one good thing about that is actually it's stimulating your own collagen as well. So yes, it is, I guess, a foreign substance we're putting in, but it's actually stimulating your own collagen in your body, which gives you it's a slow progression. So I always tell people it's not a quick fix. Dermal filler is more for a bit of a quick fix because you see an immediate result. Collagen biostimulators take about 3 to 6 months to see a result, but it's your own collagen that's being stimulated, which means you get a much longer effect because it actually is helping with that process. And there is some research, and there's a doctor that I follow in Beverly Hills who has also done her little snippets that she talks about. The collagen biostimulator actually can help remodel bone as well. So that's part of the aging process, is our bone reabsorbs. And so then our structural process, so our muscles, fat pads on our face, skin begin to move and droop, which is part of the aging
Interesting.
process.
I see. That's why that happens.
That's another thing. It's been around for a very long time. It's kind of making a bit of a comeback as well, because people are wanting, I guess, quote unquote, a bit more natural, because it's in your own collagen stimulation that's happening in that process.
And that's something you've said a couple of times as we've been chatting over the afternoon, Shiree, is that these things have been around for a long time. And I guess that gives a little bit of comfort, if you like, that they've been tried, they've been tested, they've been used for lots of different medical purposes. And now they're sort of finding a rebirth in cosmetic surgery. And like you've said, sort of reusing what the body's already doing, and even understanding how the body's processes work so that you can stimulate it in the right way for that sort of anti-aging approach.
Yeah, for sure. So a lot of these procedures or treatments have been around for a very long time. Like the mechanical thread lifts, I think, have been around for like 40 years. Or I should say the mechanical thread lift material have been around for like 40 years. But in the last 5 years have made this really big comeback. So I think it kind of goes in these circles as to what's used, what's in favour, and then also the longevity of what the actual treatment outcomes are like. So I'm a bit of a cautious one. I will watch and observe and see what the results are like. And even though I'll have clients, are you doing this and are you doing that? I'm like, yeah, I can do that and I have trained to do that, but I think this is a better outcome and where your money is spent and longevity. So not necessarily hopping on trends, but making sure it's going to give my client the best result.
Now, an area of real interest for you, Shiree, is these aesthetics for women of colour, or people of colour, not just women, people of colour. So tell me about your findings in that and why that's such a passion for you.
So I guess I have another colleague who, I think on her social, she calls it melanin-rich skin.
Melanin-rich.
skin.
Oh, I like
I
that.
Yeah. So I guess it's just as I kind of got more into the skin side of things, you know, and coming from a nursing background, we don't know. I have a wound care background, so I know about chronic wounds and the healing process, but then past skin healing, whatever, like you're on your own. So as you're getting to this cosmetic and dermatology field, skin of colour can be a lot harder to treat than lighter skin tones, which I thought was the other way around.
Yes.
So I kind of was like going, right, well, what's happening? And a lot of it is that darker skin tones, there's potential for more adverse outcomes depending on the treatment, and also if the skin is not prepared properly. And that is often to do with the melanin in the skin. And
what are we talking about adverse outcomes?
So there is something called I'll just go one step back, called the Fitzpatrick skin scale. So that is your skin phototype based on your heritage. So it goes from 1, I think it's up to about 6 or 7. And 1 would be like your really pale skin, red hair, freckles, green eyes. Then it goes all the way, very much up to Indigenous, African, very darker skin tones. So depending on your Fitzpatrick skin type, depends on what is safe for your skin type. So for myself, being Indian heritage, depending on where you are from, I guess in India or Southeast Asia, your skin type could really vary from a Fitzpatrick 3 all the way up to 6, depending on how much melanin you have in your skin, how much sun exposure. So things for me, if I was wanting to have something a bit more invasive like skin needling, I would really need to prepare my skin because I have a risk of what we call rebound hyperpigmentation, where the controlled injury of the skin, if my skin wasn't prepared, I could actually end up with more pigmentation. And that is very much in a healing process. So we can go from hypopigmentation where, with darker skin types, you'll have blotches of white skin or hypo, so pale bits, hyper where it's darker. And that, like I said, not just in my ethnicity, but we're talking about with yourself, being of Italian background. Yeah. But, your skin type probably changes as the seasons change. So if I was to meet you in summer, you might be a lot more olive.
Little bit
olive.
Little bit olive. Yeah, that's right.
But it's important to ask a client what their heritage is, which, it comes back to the practitioner's level of understanding and education, what they ask. And some people will be like, oh, I've never been asked that before. But yeah, you need to know that mix to know what is safe. Because just because, I might treat someone in winter with a paler skin type, but they're like as olive as me in summer, they might still have that adverse outcome.
Oh, that's all just so interesting, Shiree. Yeah, honestly, I've learnt so much today because I'm such a novice when it comes to skincare products. Look, I'll use my skincare products most days, and like I said, I think I've had one IPL treatment in my whole life. It was some pumpkin peel thing. Pumpkin peel. I thought, how bad can a pumpkin be? I couldn't go out in the sun for a week.
Yep, that enzyme, the enzymatic, yeah.
And I just wasn't prepared. I'm sure she explained that to me, but I just thought, well, that's really inconvenient. I've done this pumpkin thing and now can't go out in the sun for a week. So so I'm, now full bottle on Wrinkle relaxants and gateway drugs. And I'm just so thankful for your time today. Look, I think it's been really, really interesting. I know you've got an amazing Instagram page where you do TikToks and you're really cool and happening, and that people will be able to find you on that. The name of your business is
Glow Aesthetics Perth.
Glow Aesthetics Perth, and I'm just I'm going to be checking out what it is that you do offer. I don't think I'm there yet, but look, never say never. Never say never. My
exactly
11s,
right.
I reckon my 11s are growing, and you never know. Thanks so much for your time today.
No worries, thank you.
You've been listening to My Warm Table with Sonia Nolan. In Italian, a tavola calda is a warm and welcoming table where you can share big ideas, friendship, laughter and life. So much happens around the kitchen table, and I wanted to amplify it here in this podcast. My aim is to feed your mind and soul through smart conversations with heart. No topic is off limits, but good table manners rule. I hope you'll join us each week as we set the table for my extraordinary guests who will let you feast on their deep knowledge, life experiences and wise insights. Let's keep the conversation flowing. Please subscribe to the My Warm Table podcast and share it with your friends and networks. Perhaps if they are new to podcasting, take a moment to show them how to download and subscribe so they don't miss an episode either. I'd also love you to join our community on Facebook. You'll find the group at My Warm Table Podcast. Your support is very much appreciated.